I think that fits into with this theme, because in many resource poor settings, it's very difficult to consider a drug to be used on a sort of long term, which are expensive. For instance, many countries in sub-Saharan Africa, the annual expenditure in healthcare per capita is less than $40. So, we cannot actually often, imagine using more expensive drugs that are usually not enzyme-inducers in some of these settings, because, they wouldn't be the priority within the envelope, the financial envelope that people have for expenditure. Having said that, I think that, as I said earlier, if we were to treat someone in a short period of time, it's less of a problem. But I would also accept that in many of these places, cheap enzyme inducers are the only option between seizures, not having seizures. And I have no doubts that in that sort of situation, if you have no other option, and then, enzyme inducers are better than nothing, definitely, because they make a difference. If you're having seizures in the slums of Lagos or Rio de Janeiro or Delhi, having seizures, it's not very good for your survival. But, having one of these drugs, an enzyme inducer, can make a difference between people managing to lead a relatively normal life and avoiding the seizures. Then, I think that this is a situation I would consider that they can be used until such time that we will be able to work out alternative treatments that will take care of the problem on a cost-effective way. And you could even argue that for many types of epilepsy, the best would be to prevent it. Worldwide, parasites are a major risk factor for epilepsy. Preventable things like stroke or head injuries, better perinatal care, they could decrease the burden of epilepsy by preventing it. So there's a mixture of things that we should be thinking to do in resource poor settings. And I think that it's a very important question, because worldwide, no doubt, we have epilepsy everywhere, but the great majority of people with epilepsy, probably as much as two-thirds to maybe three-quarters, they will be living in low and middle income countries.